Welcome back to our channel. In this series, we are going to explore the subject of heart disease. I don't know how many episodes this will be, as we are going to explore every aspect of this topic, so people will be well informed. Now let's dive right in. Heart disease is a broad term for problems that affect the heart and the blood vessels around it. It is not one single illness. Instead, it includes several conditions, such as coronary artery disease, heart rhythm problems, heart valve disease, heart failure, and congenital heart defects. The most common type is coronary artery disease. This happens when the arteries that supply blood to the heart become narrowed or blocked by a buildup of fatty deposits called plaque. When the heart muscle does not get enough oxygen-rich blood, a person may feel chest pain, shortness of breath, or even have a heart attack. Heart disease can develop slowly over many years. Some of the biggest risk factors are high blood pressure, high cholesterol, smoking, diabetes, obesity, lack of exercise, poor diet, stress, and family history. Age and genetics also play a role. In many cases, more than one risk factor is involved. Symptoms depend on the type of heart disease. Some people have no symptoms at first. Others may notice chest discomfort, tiredness, palpitations, leg swelling, dizziness, or trouble breathing. A heart attack can cause severe chest pressure, pain in the arm or jaw, sweating, nausea, or sudden weakness. If these symptoms happen, emergency care is needed right away. The good news is that many forms of heart disease can be prevented or managed. Healthy habits make a big difference. Eating more fruits, vegetables, whole grains, and lean proteins, staying active, not smoking, limiting alcohol, managing stress, and keeping blood pressure, cholesterol, and blood sugar under control all help protect the heart. Doctors may use blood tests, an electrocardiogram, imaging scans, or stress tests to check heart health. Treatment can include lifestyle changes, medication, procedures, or surgery, depending on the condition. Heart disease is serious, but it is also one of the most preventable health problems. Understanding the risks and recognizing the signs early can save lives. When people think about heart attacks, they often blame fat alone, but the truth is more complicated. The foods you eat every day, carbohydrates, protein, and fats, can all influence your risk, depending on the type, amount, and overall pattern of your diet. Carbohydrates are not all the same. Refined carbs like white bread, sugary drinks, pastries, and candy can spike blood sugar and insulin. Over time, this can lead to weight gain, higher triglycerides, lower HDL cholesterol, and increased inflammation. All of these changes can raise the risk of clogged arteries, which is a major cause of heart attacks. On the other hand, complex carbs from vegetables, beans, oats, and whole grains provide fiber, help control blood sugar, and support heart health. Protein also matters. Lean sources such as fish, beans, lentils, nuts, seeds, and skinless poultry are generally heart-friendly. They can help maintain muscle and support healthy weight management. But processed meats like bacon, sausage, hot dogs, and deli meats are linked to higher heart disease risk because they often contain excess sodium, unhealthy fats, and preservatives. Eating too much red meat may also increase risk if it replaces healthier foods. Fats are often misunderstood. Unsaturated fats found in olive oil, avocados, nuts, seeds, and fatty fish can actually protect the heart by improving cholesterol levels and reducing inflammation. Saturated fats, found in butter, fatty cuts of meat, and full-fat dairy, can raise LDL cholesterol in many people, which may contribute to plaque buildup in the arteries. Trans fats are the worst of all and should be avoided because they strongly increase heart attack risk. The biggest lesson is that heart health is not about cutting out one nutrient. It is about choosing better versions of each one. A meal built around whole grains, vegetables, lean protein, and healthy fats supports the heart far better than a diet full of sugar, refined flour, processed meat, and fried food. If you want to lower your risk of heart attack, think balance quality, and moderation. What you eat every day can either protect your arteries or slowly damage them. If you want to support your heart with food, the goal is not a crash diet. It is a way of eating you can actually live with. 3 of the most reliable patterns are the Mediterranean diet, the DASH diet, and a more plant-forward diet. Each one focuses on whole foods, less sodium, more fiber, and healthier fats. The Mediterranean diet is built around vegetables, fruits, beans, whole grains, nuts, olive oil, and fish. A simple recipe is a Mediterranean chickpea bowl. Start with cooked quinoa. Add chickpeas, cucumber, tomato, red onion, olives, and a handful of spinach. Drizzle with olive oil, lemon juice, garlic, and a little oregano. Top with grilled salmon if you want extra omega-3s. It is colorful, filling, and naturally heart-friendly. The DASH diet was designed to help lower blood pressure. It emphasizes fruits, vegetables, low-fat dairy, lean protein, and limited salt. Try a DASH-style breakfast bowl: plain Greek yogurt, blueberries, sliced banana, oats, and chopped walnuts. Add cinnamon instead of sugar. For lunch, make a turkey and avocado wrap with whole grain bread, lettuce, tomato, and a side of carrot sticks. The key is keeping sodium low while still making food taste good with herbs, citrus, and spices. A plant-forward diet can also be excellent for heart health. It does not have to mean going fully vegan. It simply means making plants the star of the plate. One easy recipe is lentil and vegetable soup. Sauté onion, garlic, carrots, and celery in a little olive oil. Add lentils, diced tomatoes, low-sodium broth, and spinach. Simmer until tender, then finish with black pepper and a splash of lemon. Serve with whole grain toast. The best heart diet is the one that lowers processed food, added sugar, and excess salt while raising fiber, healthy fats, and nutrient-rich meals. If you build your plate around vegetables, beans, whole grains, nuts, and lean proteins, your heart gets stronger support one meal at a time. Heart palpitations can feel scary, but they are often not dangerous. You might notice your heart pounding, racing, fluttering, or skipping beats. Sometimes they happen after stress, caffeine, poor sleep, or exercise. Other times, they can be linked to dehydration, certain medicines, thyroid problems, anemia, or an abnormal heart rhythm. If you feel palpitations, the first step is to pause and check for triggers. Sit down, slow your breathing, and try to relax your body. Drink some water if you may be dehydrated. If caffeine, nicotine, energy drinks, or alcohol are common triggers for you, cut back and see whether the symptoms improve. Getting enough sleep and managing stress can also make a big difference. Some people find that gentle breathing helps. Breathe in slowly through your nose for 4 counts, then out for 6. This can calm the nervous system and sometimes ease a racing heartbeat. If your palpitations happen during exercise, stop and rest until your heart rate settles. It is also important to know when to get medical help. Seek urgent care if palpitations come with chest pain, shortness of breath, fainting, severe dizziness, or if your heartbeat stays very fast or irregular for a long time. You should also talk to a doctor if the episodes are frequent, getting worse, or happening for no clear reason. A clinician may ask about your symptoms, check your pulse and blood pressure, and possibly order an ECG, blood tests, or a heart monitor. Treatment depends on the cause. Sometimes the fix is as simple as reducing stimulants or treating stress. In other cases, medicine or further testing may be needed. The key is not to ignore repeated palpitations, but also not to panic every time they happen. Track when they occur, what you were doing, and what you had consumed beforehand. That information can help you and your doctor find the cause faster. That is all we can take for today. We will continue from here next week. Please like, share, and subscribe. Thank you.